Resume recording. Okay, guys, so you can see now the benefits, the topic of today. It's going to be the benefits of monitoring your cardiovascular health. So what do I mean by cardiovascular health? So today we're going to talk about those active performance indicators such as blood pressure and heart rate that many of the smart bands tracks, but most of us who are not health savvy or working in that field may be wondering why tracking our heart rate or our blood pressure. So first of all, I'm going to talk a little bit about what can a smartband do. So a smartband can track, can store, can analyze, can alert, and prevent. Those are the 5 main actions that a smartband can do. Why did I put a small mark on analyze, alert, and prevent? That's because not all smartbands do this. So whenever we are comparing what smartband to buy, we have to make sure that we're getting the most out of it, because many of the smartbands sold out there in the market, they just track and store and show you a number. But what do I do with that number? So we need to know more. So we need to seek for those smartbands that do analyze the data that it's collecting, and it's going to create an alert to prevent a specific disease or a risk factor. So are smartbands luxury? This will depend on your point of view. We can discuss it. This is a gray line. Many of you may think of luxury. Many of you would think this is a necessity. I'm going to give you my point of view based on the evidence that it's upon today, right? So it is very clear that sedentary lifestyle leads to multiple number of health issues, including chronic diseases, acute illness, low productivity, depression, high amounts of stress, weight gain. There has been many studies linking sedentary lifestyle with a lot of health issues. It's also clearly stated, and if you dig upon your healthcare system in your country, I'm going to give you the statistics of the US. And the US budget for healthcare, 80% of this budget is spent on acute disease and not preventive medicine. The 20%, the resting 20% is used for doing research and developing preventive medicine. What does this mean? And that is why I am telling you this is just a rough number, but this is very common. This ratio of 80-20 is very common upon many developed countries, and in developing and low and middle income countries, there is non-existence of funding for preventive medicine. The 100% of the budget goes into dealing with the acute disease. Why? Because these are the problems that are affecting us now. So the government doesn't have any more money to spend on research, on prevention, because they have to deal with the patients who are suffering from chronic diseases and acute diseases right now. They cannot tell these guys, listen guys, we're investigating and we're doing research about the diseases, so hold on and we'll come back at you in the next year. We cannot do that, unfortunately. But we have seen that improving and spending more on preventive medicine, on educating people, we can decrease the burden of diseases, and we can decrease the amount of people getting sick today to focus on preventive medicine. We also know that humans are competitors by nature. It's in our core. We are achievers. And therefore, smart bands come in that precise moment where healthcare is not working. It's overflowing of patients with acute illness that needs to be seen right now in the hospitals, are taking all of the funds, and there's very less for preventive medicine. So what do we have left? How can we encourage people to learn about their health, to worry about their own health, and take actions upon their own health based on what? First, we need to educate them, and secondly, we need to have some devices that can help all of these people track their own vital signs. That's why the smart bands come in a very critical time, where I think it's a golden opportunity for all of us to decrease in our healthcare spending and to increase our health. It's a win-win situation. We also have to remember one last thing before I change the slide, is that smart bands have opened a new way of measuring ourselves, because remember, we are unique. I have told you this from the point of view of the genetics, from trying to do a specific diet that works for our body. It's the same for our exercise, for our health. We work differently and we have different measures. Before, we used to compare ourselves with the average, but that's not the case in 2019. We have to start taking care of our own, and we have to compete and to measure our performance, our vital signs based on the average of ourselves. We can see if we have improved by comparing us with ourselves 1 month back, 3 months back, 1 year back. We have to stop comparing ourselves with the neighbor, with the guy who shares the running treadmill in the gym, with the guy who is sitting next to us at the bench doing bench presses. We need to start comparing ourselves, our progress, with our own measures. So it brings many benefits, such as personal accountability, what we were talking just now. We have individual tailored goals, so smart bands in general can help you achieve goals faster by tracking your progress of what matters most for you. Let's say you're doing weight loss, you're improving your endurance, or you want to improve your performance. You can measure yourself and compete with yourself only. And last but not least, it helps you, or it empowers you to understand your health data. Remember, I told you that most of the devices will track and store your data. Well, it is the case of the latest smart bands and the best ones that analyze that information and provides you with information, with useful information. So what does this mean? That you will learn and understand your health data. You'll start to learn about your health vitals, normal parameters, what are risk factors, how can I prevent all of this, right? So this is what we're trying to achieve with all of these devices that are helping the medical field. What benefits can I get after my bio data is analyzed? Well, by allowing a smart band to measure, track, and analyze your data, you will get a better grasp of your health status. Also, if this data that you get measured by these smart bands, you also combine it with artificial intelligence, then you get even better information yet. Because you're getting information, the more information you give to the artificial intelligence of you, the more detailed, the more specific advice the artificial intelligence can give to you. So that's why we're landing in the future, basically. We're getting all of this technology. We just need to refine it every day a little bit more to be every time more and more accurate. With this, what are we achieving? We make better informed decisions about your health. Remember what I told you about the funding of the healthcare systems all around the world? They are broken and they are badly managed. So the small amount of money that is spent on preventive medicine is not enough to take care of yourself. So either you make the change and start dealing with your health and taking responsibility of your health, owning your own biodata and analyzing it and taking better informed decisions, or wait till the public funding and the governments do something for you. Seriously, if I were you, I would start worrying about myself and my health, because we don't know and we're not certain how many years we're gonna have left till the wheel goes the other way around. It's gonna be 80% for preventive medicine and 20% only for dealing with acute illness. But for that to happen, it is very hard because we need to train people to empower and to know about their health. Also, this biodata will help you to prevent the silent killer. I'm going to explain you a little bit more about that on the next slides. And overall, it will help you improve on performance. So I have named or written 3 benefits of heart rate monitoring. As you know, knowledge is power. And when it comes to your health, it can give you the benefit of monitoring the intensity of your workout. So many people exercise without knowing their heart rate. You may have a hunch, okay, so I'm doing the right exercise because I'm feeling tired. Maybe you are not doing the right exercise or the workout because you don't know measuring the intensity. It's very subjective because you're doing it by how you feel. By tracking and having a smartband, you can ideally monitor by knowing your heart rate. We're gonna see that we have different ranges, and then we can classify those into the type of exercise. You take care of yourself and also learn to be safe. You also have to be on the safe line. How do you know that you're not over exceeding your heart capacity? What if you're doing the exercise and you're overstepping your limits? So by using a smartband, you can also learn how to monitor and control this. You will also increase the accuracy of other parameters that smartbands tracks, such as calories burned. Because, for example, in the past, we used to have an algorithm or a mathematical formula for calculating calories burned based on duration and distance. But if you add to this formula of duration and distance, you add your weight and you add also your heart rate, then you will get a better and more accurate measure of your calories burned. So for me, those are 3 main reasons, good ones, for you to learn the benefits of heart rate monitoring. What's the normal heart rate? Well, it's said on the literature that your resting heart rate should be between 60 and 100 heartbeats per minute. This will depend upon if you're on the side of the athletes or people who do exercise. You tend to have a lower resting heart rate or closer to 60. And if you have a sedentary life, you will be on the right side, that it's close to 100 heartbeats per minute. The good thing is that there's not an age for you to start moving, and you should always aim to be to the left side. There are also many other factors that can influence your heart rate, such as your age, your fitness level, if you smoke, your diet, if you have a cardiovascular disease. But all of this, the good thing is that they are connected. So if you work out regularly, you have healthy habits, you don't smoke, you don't drink, then chances are that you're going to be switching to the left side of the resting heart rate very quick. Also, another important thing is that if you have a smart band that is tracking your heart rate, and for example, you know that while you're exercising, you get to 150 heartbeats per minute, you're happy because you're getting to do an extensive workout, that's fine. You know that it's upon the normal heart rate, but that's because this is the resting heart rate. I'm going to tell you after how to calculate your maximum heart rate. But let's say that you have constant reading either below or above the average value. So you're having constant readings that the smartband tracks that you're having 50 heartbeats per minute, or is the other way, you're having 120 and you're not doing exercise. So this raises a question. It also triggers an alarm that says, pay attention because this is not normal. Either check it again, recalibrate your smartband device, go with a healthcare physician to do a regular checkup, because something might be wrong there. So it's also kind of an alarm to prevent something that can cause you disease in the future. So how do you know your maximum heart rate? It is very easy. It's done by this formula you can see here, 220 minus your age. So for example, if you have 30 years, your maximum heart rate should be 220 minus 30, 190. So this is your upper limit. And depending on the type of exercise you are performing and the objectives you want to achieve, calories burn, doing performance or endurance, then you have different target goals. We're going to see when we touch upon the types of exercise, how to use this on types of exercise. For today, I just want to show you how important is to start tracking your own vitals signs. Okay, so normally any workout that you do is going to be between 50 and 85% of your maximum heart rate. What does this mean? That we rarely are going to be, if suppose you have 30 years like myself, rarely I am going to have 190. If I'm doing that, that should trigger an alarm, because that is not normal. It's my maximum heart rate, but I should aim all exercise to be between 50 and 85%. It's only on specific athletes that you will aim for a workout as high as your MHR, your maximum heart rate. The American Heart Association and the CDC, the Centers for Disease Control, recommends a general target rate of 50 to 85%. And it classifies into the types of exercise. So if you want to do moderate exercise, you should aim for 50 to 70% of your MHR. and for vigorous exercise, 70 to 85%. Okay? So what are the benefits of monitoring your blood pressure? So remember that I gave you 3 main important aspects for monitoring your heart rate that I thought they were the most useful and that you would feel identified with those. For blood pressure, I'm going to give you one, and this only one condition should be enough for you to say it's good to measure my blood pressure regularly. So this is to prevent cardiovascular disease. For some of you, this might be enough, but I'm going to dilute it a little bit more and to break it down a little bit more to help you understand what's cardiovascular disease and why I should be afraid of only telling these words. According to the World Health Organization, high blood pressure affects 1.1 billion people worldwide. Breaking it down a little bit more, 1 out of 3 people die of cardiovascular disease worldwide. So chances are that if you're watching this conversation among 2 other companions, 1 of you are going to die of cardiovascular disease. I'm trying to make you understand this in real numbers for you to identify and to know the importance of preventive cardiovascular disease, because then we're going to see how illogical it is that the cardiovascular diseases are accounted for 33% of the deaths worldwide, and it can be prevented. So that's the point that I'm getting at. Hypertension is one of the major risk factors amongst others, because there are many risk factors for cardiovascular disease, but hypertension is the number 1. Hypertension is known as the silent killer. Remember, we talked about the silent killer and the benefits of having a smart band device. Well, this is the silent killer. Why is it called the silent killer? Because it shows no symptoms in the early stages. You feel no difference. You can have high blood pressure that on the early stages, everything is going to be normal. It is after some damage has been done on the later stages of the disease that you start to have some symptoms. So when this happens, generally it's harder to switch and to change this disease, right? It's not impossible, but it's going to take a little bit more time and medicines and efforts to bring it to the normal side than if you would do a regular checkup of monitoring your blood pressure and on the early stages identifying it. So this is why I only name one only benefit of monitoring your blood pressure, and I think this should be enough. This is according to the latest guidelines, the average ranges of blood pressure. You see, we have normal blood pressure, elevated blood pressure, stage 1 hypertension, stage 2 hypertension, and a hypertensive crisis. And on the left side, we have the definition for each of these. These are not made by me. These are the latest guidelines, are done by the American College of Cardiology and the American Heart Association. It's a guideline for prevention, detection, and management of high blood pressure in the US. These are 2017 guidelines, and I thought it would be also important to share it with you. Please also write me down if you have questions. I'm going to address them in the end. And also, if you feel that the presentation it's too deep or too concentrated, for me to maybe slow it down, and for the rest ones, try to do it slower. Or if you think this is a good pace, also write it down so I can know that you guys understood and that we're getting something good out of this, because you're putting some time. I'm also putting some time, and our goal is for all of you guys to understand and have a better grasp of your health. Here, I wanted to share, I know you're not doctors or epidemiologists, but I want you to share the top 10 global causes of death with a 16-year period gap. Why did I do that? And this is to prove what I was talking to you in the beginning about healthcare spending and the budget and how it's the ratio, how is being done. So because we have today many diseases, acute illness to treat, therefore we need money to cure them, right? So we're treating only acute disease, as I told you before. So the only rest of the money, the very small amount rest of money that is there, like the leftovers, are being used for research and development. So this is translating into this graph only shows that in this 16-year period gap, nothing has changed. The healthcare system has been the same. Why? Because non-communicable diseases and preventive diseases haven't changed, haven't diminished, haven't decreased. The graphs is showing exactly the same. And look at the first two causes of death globally. These graphs are done by the World Health Organization, and you can see that the first two is ischemic heart disease and stroke. Those two are cardiovascular diseases. Those two are the ones that I was telling you that can be preventable by having a good lifestyle. That means doing regular exercising regularly, having a healthy diet habits, quitting smoking. So this means that it's in our hands, we can change it. Why it hasn't changed? Because people don't know. Doctors are too busy treating illness. They cannot spend their time educating people. So this is just for all of you to have goosebumps and to learn about the importance of owning and empowering on knowing about your health. Our goal is increasing our quality of life. It's not about living longer, it's about quality of life. So by doing this, we're targeting to have a better quality of life. If we're going to live 60 years, let's have 60 great years of our life. If we're going to live 80 years, let's have the greatest 80 years we could ever dream of. Let's not spend, if we're going to have 80 years on earth, let's spend 40 good, having our first stroke at the age of 45, having some other cardiovascular disease or a heart attack by the age of 60, and having a very poor quality of life on those last years of our life. Just a quick reminder, whenever you're seeing the smart bands, check on whether they have this quality, what are the sensors they're using, if this biodata is being not only tracked and stored, but also analyzed and interpreted. In Xfinity Labs and WGN, we're trying to bring all of these down by doing this group of elements to give you the tools to empower upon your health Okay, so we're trying to give you all of these tools for you to do the changes that you need to do in your lifestyle, for you to be able to have proper information and do better informed decisions. So what better than having a smart band also mixed with artificial intelligence? Because then we don't only have the benefits of the smart band itself, but we're also having the benefits of many of the other products or tools, as I like to call it, that are available to improve on your health. What are those other products? Like suppose if you have genetic testing, if you have risk factors questionnaires, assessment questionnaires that you have filled, all of this information, the more information the computer has about yourself, the more informed decisions can make, or the more accurate decisions can give you about your own health. Remember, be realistic and don't push yourself too hard and too fast. The changes in lifestyles have to be slow but steady. We're not trying to do something from one day to the other, from 1 month to the other. We're trying to build a healthy lifestyle, and we're trying to empower you to have the tools to be able to do it. That's our objective at World Global Network, and it's to make you, in overall, a better you. Thank you very much. I'm going to see what's if you guys have any questions. Let's see the chat. Okay. Hello, Claire. Great pace. You're welcome. Okay, the speed is right. Sounds good. Okay, guys, I see many participants, but not many questions. Please be free. Okay, we have a question. Go ahead. Feel free, if you come up with some other questions, you can email me or write me down on Facebook, and I'll try to address them as quickly as I can. I apologize if some of you have written me and I haven't been able to reply. It has been a little bit busy for me. We have many programs ongoing, but I always try and I always do respond. I have a question on the health and wellness report. Okay, if you want to write it down, you can write it down. The other thing, guys, if you're watching me tomorrow, I'm going to give this same presentation on Spanish language, and I got some comments on why not on French. When was the French version coming? So, je suis désolé. Mon français, c'est très drôle. Je ne peux dire ou parler avec le médecin en français. So this means that my French is very basic and I don't feel comfortable giving a lecture on healthcare issues on French. So we're trying to get to all of those communities that are not English or Spanish speakers, but please be patient. We're working on specific seminars to try to deliver on this year on each region according to your language. But I apologize, my French is not that good. I can understand, but I'm very dumb at speaking. So let's see if you were able to write the question. Okay, the health and wellness report, this has nothing to do, please, to all the other participants. We have a question that wants to know if the health and wellness report will tell you, according to your DNA type, the percentage of potassium you need, sodium you need, and so forth, according to your specific genetic type. Okay, So I'm going to respond it, but please know that this is a different topic, is the health and wellness genetic testing. We do not give you specific percentage of potassium or sodium because these micro elements change very fast according to your daily needs. This is not about your genetic predisposition. This is about daily needs. So it will depend. That's why we always tell you that you need to have a proper balance of diet, to hydrate yourself very good. You can have some supplements as well, but trying to land you on a specific question on what does the health and wellness report does. You can see a little bit more if after the answer is not clear on the video that is uploaded on Facebook on health and wellness report itself. But the question or the answer is this: we gather whatever research is being done linking, suppose, vitamin deficiency with a specific genetic type. So if the artificial intelligence checks or identifies that your genetic profile matches that study, it's going to give you an output that it's going to say, listen, you have a predisposition for having low absorption of this, but we don't give values. That's not for genetic testing to give, because percentage of what you need, you can see it in a blood test, but it's going to change. It's not even important because these change very fast. So unless you have serious symptoms related to sodium and potassium, you won't be needing to do this blood test daily. Your doctor may do it once a year just to know on a general status what's your healthcare status. But the genetic testing, what it gives you, it's we go before that. So today, the present, with our blood test, we know what are the current values of something, suppose potassium or sodium. Genetic testing, it's long before that. It's how we were built. So if we have a predisposition for not absorbing correctly sodium, we might be having lower sodium than the rest of the people. So it's very possible that if we do a blood test, we're going to be low on sodium, unless we have a healthy diet, we have some supplements, and then we can fill this gap. So what I'm trying to say is that the genetic testing help you prevent, but it's not going to give you actual values. Okay? Was that enough for you? Please, if you feel that you need further down explanation, I don't want to take the time of the rest of the participants, but we can engage into a conversation. You can write me an email. I'm always trying to help you. And my goal is not only for you to understand how these products work, but for you to empower you and to gain on your health. Overall, true, you also need to show these products, but I want all of you to improve on your health, to be better. So thank you very much, and goodbye to everyone.